Hi, I'm Dr. Larry Malerba, and welcome to the newest feature of All Things Homeopathy. In each new episode of the ATH Clinical Case Series, I will present a case treated with homeopathy. Each case is designed to highlight different aspects of homeopathy. Some have been chosen to demonstrate homeopathy's therapeutic capabilities, its ability to heal acute illness, chronic physical disease, mental emotional problems, and even things that most people don't realize are treatable. Other cases are designed to illustrate the unique nature of homeopathic thinking regarding illness, how illness develops, how it is treated, and how homeopaths solve cases. In order to keep these presentations short, it's been necessary to leave out some details. All cases are used with permission, and names and other identifying factors have been altered in order to ensure confidentiality. So let's get started. I chose this first case in order to show the power of homeopathic healing and how a single, straightforward prescription can yield such rapid results. Terry is a 65-year-old landscaper with a chief presenting complaint of Lyme disease. The problem began 2 months prior to meeting me when he developed a swollen lump behind his left knee. A doctor drained the lump and prescribed an antibiotic. Soon thereafter, Terry developed a rash on his legs, back, and chest. No tick was ever found, but blood work showed him to be Lyme positive. In spite of 2 courses of doxycycline, a standard antibiotic for Lyme, he developed joint aches, which were beginning to incapacitate him. "I can hardly walk," he told me. He complained of pain in his knees, hips, and ankles. "It takes a minute to make the first couple steps. It loosens up if I walk around," Terry said. He explained that his hands were very stiff when he woke in the morning. His left hand was worse than his right. His right hip was also very stiff, especially when he tried to lie on that side in bed at night. I asked if his arthritic symptoms were affected by weather. He said he had felt worse just before a storm recently. He acknowledged that prior to 2 months ago, he had his share of occasional aches and pains, but nothing like this. He's been much worse since his Lyme diagnosis. Terry also complained of a lot of fatigue. "I can't stay awake," he said. He used to be a morning person and he liked to get an early start, but now he feels worse upon waking in the morning. I asked if he tended to be more warm-blooded or chilly. He said he's become more chilly over the past year. Based on this information, I prescribed 2 doses of Rustox 30C, a homeopathic medicine made from poison ivy. Just to be clear, I don't mean 2 doses per day. I mean 2 doses in total, one to be taken in the morning and another in the evening. Terry returned 3 weeks later, obviously pleased. "I was a new person the very next day," he said. "Almost like my old self again. I started working that day, doing things that I'd put off all summer. The fatigue went away so fast. I can focus my train of thought. My mind used to wander. I got a lot done. I'm taking on new work. I tell everybody what an improvement I've seen." His pain, stiffness, and fatigue were virtually gone, and he was back to working like he was prior to his diagnosis of Lyme. 2 tiny doses of a homeopathic remedy had turned Terry's life around and had accomplished what 2 courses of antibiotics could not. Remember, remedies are not like drugs, which must often be taken indefinitely. A couple doses, in this case, served as a catalyst to provoke a healing response. Without Rustox, he might have spent the rest of his life suffering from the insidious effects of Lyme-related arthritis. Now let's review the clues that pointed to the need for this particular remedy. Rustox is famous in homeopathic usage for its effectiveness in a wide range of arthritic conditions. The defining features are pain and stiffness that are worse upon initial motion after having been at rest. The person with an arthritic knee, for example, takes a long drive in the car. On getting out of the car, the knee is stiff and painful. It takes a while to slowly limber the knee up to walk off the stiffness. The knee feels better for a while until it reaches its limit, at which point it starts to hurt again from overuse. The person sits to rest the knee, it stiffens up again, and the process repeats itself. Additional clues that matched Terry's profile included the fact that Rustox symptoms tend to be more left-sided, The pains are worse by lying on the painful side and are worse before stormy weather. The interesting thing is that the choice of homeopathic remedy is based less upon the diagnosis than it is upon the specific characteristics of the symptoms of the illness in question. In Terry's case, his Lyme symptoms matched the profile of Russ Tox. 10 other patients with Lyme could easily require 10 different homeopathic remedies, depending upon the specific details of each individual case. Remember, in homeopathy, there are no shortcuts. There is no one-size-fits-all treatment for Lyme or for any other illness for that matter. I hope this case gives you some insight into the power of homeopathy, and I hope that you'll continue to follow along with the ATH Clinical Case Series and all things homeopathy.